Hi, I'm Dr. Sharbell Hashoul, and today let's talk about breast MRI, what it is and why some people need it while others don't. If you've ever heard your doctor mention an MRI for breast screening and wondered why you'd need one when you already get mammograms, you're not alone. It's one of the most common questions I hear. So let's clear it up. First, what is a breast MRI? MRI stands for magnetic resonance imaging. Instead of using low-dose X-rays like a mammogram, it uses magnets and radio waves to create very detailed pictures of the breast tissue. Before the scan, most people receive an injection of a contrast dye through a vein. This dye helps highlight areas where blood flow is different, which can sometimes point to abnormal tissue. Because it's so sensitive, breast MRI can pick up things that mammograms or ultrasound might miss. But here's the key thing to understand. More sensitive doesn't automatically mean better for everyone. MRI also has a higher chance of spotting things that look suspicious but turn out to be harmless. This is called a false positive, and it can lead to extra tests, biopsies, or worry that wasn't ultimately necessary. That's why breast MRI isn't used as a routine screening tool for the general population. It's reserved for specific situations where the benefits clearly outweigh those downsides. So who typically benefits from breast MRI? Generally speaking, medical guidelines recommend it for people at significantly higher than average risk of breast cancer. This includes those with a known genetic mutation such as BRCA1 or BRCA2, or a strong family history that puts their lifetime risk well above the general population. It's also sometimes used for people who had radiation therapy to the chest at a young age, for instance as part of treatment for another cancer earlier in life. Breast MRI is also used in some other specific circumstances, not as a screening tool, but as a problem-solving one. For example, if someone has already been diagnosed with breast cancer, MRI can sometimes help doctors understand the full extent of the disease before planning surgery. It can also be used to check how well breast tissue is healing around implants, or to investigate findings that remain unclear after mammogram and ultrasound. It's worth saying clearly, having dense breast tissue alone does not automatically mean you need an MRI. Dense tissue can make mammograms a little harder to read, and it's a factor your doctor considers, but it's just one piece of a bigger picture that includes your personal and family health history. So, what's the practical takeaway here? If you're not sure whether breast MRI applies to you, the best step is to talk with your doctor about your personal risk level. This might involve looking at family history, any genetic testing you've had, and other individual factors. Your doctor can help you understand whether additional imaging makes sense for you, and if so, how often. Breast imaging isn't one size fits all. The right test for one person might not be the right test for another. And that's completely normal. It's not a sign that something is being missed or overlooked. Every screening plan is designed around the individual. As always, this video is meant to give you general educational information, not personal medical advice. If you have questions about your own breast health or screening plan, please talk with your doctor. They can look at your specific history and guide you to what's right for you. Thanks for watching, and I'll see you in the next video.